Table 5-11 is the gluteal muscles. We are going to identify 5 muscles and then 1 additional structure. The first muscle of this group is the tensor fasciae latae. And this is a very superficial muscle. And you can see where it has its origin on the iliac crest and the anterior superior iliac spine. And its insertion is going to be on this structure here, which is actually one of the structures on this table, is the iliotibial band. And it is a thin band of connective tissue where the muscle fibers of both the tensor fasciae latae and the gluteus maximus, the muscle fibers end and the connective tissue continues on. The tendon will continue on as a flat, broad sheet, and that is the iliotibial band. So this tensor fasciae latae muscle will assist with flexion, abduction, and it will medially rotate the thigh at the hip joint. So we've already looked at hip flexion. This is what hip abduction looks like, or bringing the thigh away from midline. And this is what medial rotation looks like right here. So the first they're showing you flexion of the leg at the knee joint and then medial rotation. The next muscle of this group is the gluteus maximus, and it is the most superficial gluteal muscle in the posterior region, and it has a large point of origin. It will originate on the iliac crest, the sacrum, and the coccyx. So this entire horseshoe shape. And it will also have quite a large area of insertion. So where it's cut off here is where the gluteus maximus will continue on as the iliotibial tract, but it also has an insertion on the linea aspera, as well as the gluteal tuberosity of the femur. The action of the gluteus maximus is to abduct the hip, which we've already looked at, and laterally rotate the thigh at the hip joint. So this is what lateral rotation looks like. So it's basically bringing in your thigh from the medial position to the lateral position. So that's the lateral right there. So I'm going to hide the gluteus maximus and show you the gluteus medius. And this is the gluteus medius. So the medius actually pokes out from underneath the maximus. So I'll put the maximus back on. And you can see the origin of the gluteus medius from underneath the maximus. So its origin is on the iliac crest of the ilium. And if I hide the gluteus maximus, you can see the insertion on the greater trochanter of the femur. So right here is where the greater trochanter of the femur is. And the action of this muscle is to abduct and to medially rotate the thigh at the hip joint. And we've looked at both of those actions already. Just underneath the gluteus medius is this fan-shaped muscle that sits very close to the surface of the ilium. And this is the gluteus minimus. So in order to see its point of insertion, I'm going to hide the IT band as well as the tensor fasciae latae. So you can see where the gluteus minimus will insert on the greater trochanter of the femur as well. So the gluteus minimus will also abduct and medially rotate the thigh at the hip joint. So same action as the gluteus medius. And then the last muscle of the gluteal muscles is the piriformis. And this is the piriformis. So it sits deep to the gluteus maximus. And based on its orientation in the thigh, it's going to cause a lateral rotation. So again, we looked at lateral rotation, but here it is close up. So number 9 is, what is this muscle that is highlighted? Its origin is up on the iliac crest and the anterior superior iliac spine, and its insertion is on the iliotibial tract. Again, number 9 is, what is this muscle?